Hello, and thank you for joining me. Today I'm going to share some of my observations and ideas around lifestyle medicine, approaches to managing mood, and the key role the prefrontal brain areas play in this. I will tell you my story of how I became interested in lifestyle medicine and what I've learned, and we will look at how attention and concentration ability appears to be a key factor that determines healthy lifestyle, the prefrontal cortex or PFC and its key role in attention and mood, how lifestyle affects the prefrontal cortex and mood, and some useful tools that you can use to help yourself and patients. I'd like to tell you about a powerful idea that has helped me to focus on where and how I want to make a difference in people's lives. A few years ago I came across Gary Keller's book, The One Thing. He writes about the incredible power of doing things in a specific order that amplifies the effects. This is the so-called domino effect. When applied skillfully, it allows us to have a massive impact by starting with a comparatively small initial action. Now, in order to harness this power, we need to answer what Gary calls the focusing question, which reads, what is the one thing that I can do that by doing it will make everything else either unnecessary or easier to achieve my goal? Now, applying this to what I was working on at the time, I asked, what is the one thing that I can do that by doing it will make everything else either unnecessary or easier to prevent dementia? My team and I had been developing dementia prevention programs and focusing on mild cognitive impairment, where patients already had a degree of cognitive impairment. We developed the Thinking Fit program, which I will tell you more about in a moment. We, however, realized that dementia has a long prodromal phase for most common causes like Alzheimer's and cerebrovascular disease, and we decided to move the focus earlier, targeting patients at risk of the risk factors for dementia. These risk factors included inactivity, obesity, hypertension, and TIAs. With both these studies, we showed that it was possible to engage inactive people in regular, healthy activities that resulted in positive outcomes. The Dance Fit study was designed to engage younger participants in a dance-based fitness activity that was delivered at GP practices. Now, if we just look at the results from the Thinking Fit study for a moment, we were able to engage patients with mild cognitive impairment in regular physical activity, just getting them to walk. We made it fun for them to take part in group-based activities for cognitive stimulation and to regularly do brain training on tablet devices. The results from the Thinking Fit study showed positive effects on physical, cognition, and quality of life outcomes. The program was adopted by the largest dementia charity in India, and they have hundreds of regular participants in several centers and now use mobile units to deliver it. Participants love doing it, demonstrating that carefully designed lifestyle interventions can be engaging and beneficial. The modifiable risk factors for dementia, which excludes genetic factors at this stage, accumulate even from the prenatal period. Reviewing the risk factors for dementia, I realize we will have to even intervene even earlier to address diet, education, and smoking. I therefore realized that the more powerful question to ask was, what is the one thing that I can do that by doing it will make everything else either unnecessary or easier to maximize health and well-being? My research led me to a number of lifespan studies with results that have profound implications for our thinking about healthy living. One key study is the Dannhauser study. It followed 1,000 children born between 1972 and 73 for up to 5 decades now. Results after 32 years showed that self-control powerfully predicted health and well-being. A similar Swedish study of more than 1,000 13-year-olds followed up to the age of 47 showed that task persistence predicted educational and occupational attainment that correlate closely with health. And a US study showed that a child's attention span or concentration ability tested at the age of 4, powerfully predicted academic achievement in school and the likelihood of getting a college degree. In the Dunedin cohort that we spoke about first, it was found that a small percentage of the population had the highest risk and disease burden, and this showed a moderate correlation with brain health or cognitive ability. It is important to realize that it is not simply a case that those with ADHD are affected in a binary fashion because they struggle to pay attention. Rather, there is a gradient of risk depending on attention ability for each of the poor outcomes measured, including single parenthood, criminality, poor health and drug addiction, and living in poverty. If we look at the terms used in these research studies, such as self-control, task persistence, and attention span persistence, they refer to attention or concentration skills measured using observations and tests. A useful practical concept is persistence on task, which simply refers to the ability of a person to complete a repetitive, relatively boring task for a long time, like 20 minutes. The take-home message from all these studies is that attention or concentration ability powerfully predicts health and success. The results from these and other studies indicate the powerful reciprocal effects of attention and health. This is not surprising because concentration or attention is fundamental for learning, fundamental for doing, and it is for this reason that I started Smart Start Minds to offer pioneering neuroscience solutions that build or augment the key thinking skills for health and success. If attention is so important, what controls it? Well, the prefrontal areas of the brain are key in controlling attention and related cognitive functions, which include speech, working memory, executive control, attentional control, inhibitory control, error monitoring, and planning. I said at the beginning that we're going to look at the interactions between mood, the prefrontal cortex, lifestyle. So what are the interactions between the prefrontal cortex, attention, and mood? A useful shorthand for common mood problems like depression and anxiety is that depression is the feeling of grieving after losing something, and anxiety is the fear of losing something. This something can be real, like a person, a home, or money, or abstract, like a dream or status. A similar useful shorthand for happiness is being in a growth state where someone feels they are making progress towards a meaningful and hard but not impossible goal. Contentment is the feeling of growing enough. In every moment, your mood is determined by the balance between these opposites, depression and anxiety on the one hand, and contentedness and happiness on the other. When we look at mood regulation in the brain, in simplified terms, mood is determined by the balance between the activity of the subcortical emotion areas, which includes the amygdala and nucleus accumbens, and the prefrontal areas. This model from Heatherton and Wagner illustrates it well. Factors that increase the emotional drive from the subcortical areas include exposure to cues, such as situations and people associated with strong emotions. On the other hand, factors that decrease prefrontal cortex ability to control mood include persistent negative mood and views about oneself. It can also be caused by depleted brain energy and neurotransmission resources. Examples include all conditions that affect glucose metabolism, such as diabetes, and neurotransmission. So, for instance, drugs like MDMA that deplete serotonin risk low mood. Alcohol consumption inhibits prefrontal cortex function in the short and long term, and prefrontal brain damage can result from head injury, acute stroke, or more gradually from cerebrovascular disease related to smoking, diabetes, and vascular disease. The importance of prefrontal cortex functioning and controlling mood is clearly demonstrated in ADHD. Meta-analysis has revealed that in typical ADHD, the maturation of the prefrontal cortex is delayed by around 4 years, and the risk of depression is increased more than 5-fold. Self-esteem is also characteristically low in depression, and functional neuroimaging shows that self-esteem correlates with the magnitude of activation in the prefrontal cortex. But what about brain activity in depression? The prefrontal cortex is divided into dorsolateral and ventrolateral areas. In depression, the balance of activity between these two areas shift. Patients who recover from depression following treatment with paroxetine show restoration of the balance. Similar changes occur as a result of successful talking therapy, with the rebalancing of the dorsolateral and ventrolateral prefrontal areas. And repetitive transcranial magnetic stimulation, one of the new non-drug treatments for depression that appears more effective than antidepressants, specifically targets the dorsolateral prefrontal cortex with the aim of increasing activation. At Smart Start Minds, we've developed a depression-specific neurofeedback training program that can increase the activity and fitness of the dorsolateral prefrontal cortex. The technique is particularly powerful because we can simultaneously improve negative self-talk and provide deep learning of lifestyle principles to improve health. When we look at positive lifestyle interventions, these usually include nutrition, exercise, sleep, meditation or relaxation, stopping smoking and limiting alcohol, and social interactions and relationships. We have seen that there are powerful interactions between mood, the prefrontal cortex, and attention. And if we consider the role of the prefrontal cortex in mood regulation, then we can look at the negative effects of lifestyle on mood and the potential positive effects of lifestyle interventions. There are many negative lifestyle elements that can inhibit prefrontal cortex control, and I will mention a few. What we can see on television and YouTube is increasingly graphic and shocking scenes of violence are common. This can trigger negative emotions in people who identify with victims. The availability of online gambling risks relapse in addicts and resulting depression and anxiety. The increase in pornography addiction distorts expectations and functioning within relationships, which then again can trigger mood problems. In my practice, I've seen an increase in pornography addiction in both men and women in the past few years. Despite the increase in global population, modern life leaves many people isolated and without support to identify and help when they are emotionally unwell. There are new risks that can deplete brain resources. Social media overuse or addiction is associated with poor sleep, reduced energy, and depletes neurotransmission resources, which then impairs mood regulation. Obesity and diabetes affects glucose delivery to the brain and hence mood regulation. In addition to alcohol, there are a growing number of legal and illegal highs and more potent preparations of known drugs like cannabis that impair mood regulation. I've recently seen an increase in the number of patients who became depressed and anxious as a result of inadvertently using stronger preparations of cannabis. The most common cause of prefrontal brain damage, in my view, is cerebrovascular disease resulting from smoking and vascular disease. This is often evident in over 50s who present for the first time with a mood disorder. A new threat comes from video games, where studies have demonstrated lasting reduction in prefrontal cortex activity in teenagers who regularly play violent video games. Looking at the potential of lifestyle choices and interventions to increase emotional regulation, we can see many opportunities. Nutritional interventions can help regulate glucose metabolism and energy supply to the brain. Exercise can also help with glucose regulation and to elevate mood via distraction. Optimizing sleep can help improve negative mood, and resting the brain helps it recover from resource depletion. Meditation and relaxation can help for negative mood, and stopping smoking and limiting alcohol can reduce cue exposure, direct toxic effects, and long-term damage via cerebrovascular disease. And lastly, social interactions and positive relationships can reduce cue exposure A good example is when a woman who has been in an abusive relationship changes to having a supportive partner. Addicts, of course, can also get support from mentors and buddies that talk them through difficult times when their own prefrontal cortex is struggling to maintain control over addictive behavior. I'd like to share some tools that I use to promote lifestyle changes. The first is self-talk and self-talk interventions. Self-talk is the private speech we develop in childhood that we use to plan our actions. It also helps us to learn by rote, to calculate, that we use during mathematics. We also use it to motivate ourselves, and importantly, we use it to soothe ourselves when we've been hurt physically or emotionally. Self-talk again depends heavily on the prefrontal cortex. It can be negative, neutral, or positive. It can be changed permanently through repetition, and it has proven positive effects on mood and behavior. For instance, a recent study showed that the power output during strenuous physical exercise can be increased by nearly 30% by changing from negative to positive self-talk. I often recommend a program developed by Dr. Shad Helmstetter in the USA, which makes it easily accessible. It's called Self-Talk Plus, and you can have a look online to find it. Lifestyle medicine depends on behavior change, and this in turn depends on behavioral flexibility. Now, I had the privilege of working with Professors Ben Fletcher and Karen Pine, who developed the Do Something Different Every Day program. This program is proven to increase behavioral flexibility, which makes it easier to stop harmful behaviors and start new helpful ones. It's effective at reducing weight, stopping smoking, and improving mood. All that is required is to complete a daily activity that you would not ordinarily do, but which is non-threatening and generally easy to complete. They've had good results with smoking, losing weight, and improving mood, as mentioned before. You can find them online at dsd.me. In order to achieve lasting change, it's good to know what makes it more likely. Now, Gary Keller, in his book The One Thing That I've mentioned, talks about having written goals and weekly accountability, and statistically this increases the likelihood of behavior change to above 70%. In terms of techniques like visualization, he also quotes research that shows that in order for this to be most successful, you need to visualize the outcome and the steps towards that outcome. And also quite crucial is to set proximal goals so that you know that what you are going to do today and tomorrow so that you get to your goal, which might be further in the future. Otherwise, it can be overwhelming. Whilst you might not be able to help with accountability for your patients on a daily basis, you can make use of an accountability group via social media, for instance, that will provide that to clients. The next option is coaching. Now, coaching is relatively new in the United Kingdom. It is forward-looking, and clients set their own goals, which may be informed by your suggestions. In my experience, paying for coaching promotes accountability and results. My team and I developed a specific coaching program for our clinical clients after they had made a recovery from a mood disorder, with the aim of introducing change into their lifestyle that will make them more resilient and successful after recovery. You could build a similar program or work with a coach to help your clients become more resilient. Now, smartphones can be considered a mixed blessing, but when carefully selected and wisely used, many apps can be a powerful ally in behavior change. The market is new and growing fast. It has huge potential power, and you have to be aware because the quality and the efficacy varies. It can also have side effects, so best to take care. In my experience, the fact that somebody owns a smartphone does not necessarily mean they know how to operate it, and clients often benefit from help to install and set up apps. An app that I often recommend is the Visualize Success app by Andrew Johnson, which has a relaxation exercise followed by visualization that has a strong focus on positive lifestyle. Revisiting the table, we can see where these interventions can have positive effects on lifestyle. I believe we are living in a unique period where we can use the wealth of health research accumulated in the past 100 years and rapid advances in digital technology to develop and support groundbreaking lifestyle interventions that support and promote each other and in many instances are superior to conventional medicine. I look forward to comments or questions related to lifestyle medicine and interventions in general, and any of the specific solutions that we have developed. And I thank you for your time.